Welcome to Arthritis Help. I'm Dr. Dave, physical therapist, teaching you how to move differently so you can feel better. Today we're talking about what I think is the number one most fundamental movement, most fundamental exercise everyone has to have in their movement toolbox in order to be healthy movers, in order to reduce pain and reduce arthritis in the back, hips, legs, even upper back and neck. And that movement is the pelvic tilt. Some people do it, not everyone does it right, not everyone does it well. So we're going to go over it today and show you a progression of how you can do it from a very simple way into a more challenging, more difficult way. So we're going to do it all in lying today. So you're going to lie down on your back, head comfortably on a pillow. We're going to start with both knees bent and hands resting at your side or on your chest. And for a pelvic tilt, all it is a backwards tipping or rolling of the pelvis. Now, as you lie here, I want you to get a sense of where your back makes easy contact with the surface and where your back is a little bit lifted. And it's a little bit different for all of us, and the back is supposed to have a little bit of arch to it. But I want you to feel that there's a part of your back that's most lifted. And if you actually lift your back a little bit more, you'll feel that that area lifts the most. And then you're going to take that area that's the highest in the air in the low back down. We're going to just press it down into the surface, into the bed, the table, the floor, whatever you're working on. And then you're just going to relax and release and let the pelvis tip forward. Let the back rise up and feel that there's space underneath your low back. And then you're going to roll the pelvis backward and you're going to flatten that space down. Now, it's very easy to roll into that upper low back, right, or that mid-back area. I want you to find a place where you can roll into that lowest section of the low back. Now, I want you to watch out as the pelvis rolls backwards and you're getting that lowest part of the back going. Feel that your ribs, put your hands right on the ribs right before they become your belly. Feel that the ribs are driving downward towards your pelvis as your pelvis comes up to your ribs. And then when you release, the pelvis and ribs come away from each other. And then when you engage, the pelvis comes toward the ribs and the ribs come down toward the pelvis. Very often people forget to bring those ribs down towards the pelvis, and it limits what their body can do, and it takes their abdominals out of the equation. We want those abdominals working. And so we're just going to rock forward so the ribs and pelvis are away. There's space under the back. And then we're going to rock the pelvis backwards, flatten the ribs, and flatten that low, low, low part of your back down into the surface. Good. And release. If this is a challenge for you, this is it. This is all you need to do. This is all you need to work on to get into mastering the pelvic tilt. If that is simple for you, we're going to then straighten out the legs. Now with the legs straight, you don't have the advantage of your legs to tilt your pelvis backwards, so it has to happen completely from your abdomen. So you're going to do the same thing. You're going to tighten up your abdominal muscles. You're going to pull your pelvis backwards, roll it back. You're going to flatten down the lowest part of your back. You're going to feel your ribs depress and flatten down and then release. If it's hard to depress the ribs, you can put a couple extra pillows underneath your head to lift your head higher. You're going to rise up, feel that space, and then come down with the back. Draw the belly in. Pull the pelvis backwards, flatten the ribs down, feel the belly muscles get strong and engaged, and flatten your back down, and then release and come up. And this is a little bit more difficult. If you have a trouble doing this, you can just put a pillow or a bolster underneath your knees. That will make it a little bit simpler. That'll be the go-between between feet up and feet down. But with these legs straight, it's very similar to standing up, and being able to posterior tilt the pelvis and flatten the back as you're standing is very important for the activation of the muscles in your hips and the health of your back, taking stress off those low back muscles. One more time, flatten the back, draw the belly, depress the ribs, and release. All right, excellent job. So just work on that, put that into your daily movement routine, and you'll see the benefits are going to pay off with all of your standing and walking and the strength that you get through your hips and legs. Thank you so much for joining me today, and thank yourself for taking the time doing the things that are going to make you feel better. Not everyone does it, but you did. I'll see you all next week with a whole new video teaching you how to move differently so you can feel better. Take care.